Welcome back to Face the State on this Sunday morning. The coronavirus crisis has many people feeling stressed, hopeless, all sorts of things. With us now is a primary care doctor, Dr. Vsanth Kainkaryum of 4 Elements Direct Primary Care in South Windsor. Dr. Kainkaryum, thanks for joining us.
Thanks for having me, Dennis.
So what kind of emotions are people feeling during this whole period?
You know, a lot of different emotions, right? So you have people who are feeling very lonely. You've got the elderly who might be feeling afraid, right? Knowing that they're sort of the highest demographic risk. You've got parents who are trying to juggle being, working full time, teleworking perhaps from home, but then also being responsible for doing homeschooling for their children. So I think, there's fear, there's anxieties. But then, one piece that I don't think we've really talked about are people who have underlying mental health issues, like people who have depression or PTSD, where all of a sudden they're faced with similar emotions of a loss of control or the anxiety that's building up. And now there's a fear of even going outside. So I think there's a lot of different emotions. And I think the important piece is we actually talk about it and we acknowledge we have those.
We're getting some different types of opinions on this whole thing as to when you should see a doctor. And there are some people who don't necessarily view seeing their primary care physician as essential, but in many ways it is because of vaccines and things like that and tests, right?
Yeah, I mean, so there's definitely things that are time sensitive, right? So on one hand, while we want to try to prevent coronavirus, there's also the routine preventive care, particularly I think in pediatrics where, vaccinations we know are key. And as we look at, a potential development of a vaccine for coronavirus, we want to make sure the ones that we have vaccines for that we have provided. So a lot of primary care physicians and practices are adjusting some of their schedules so that perhaps if you're healthier, you might come early in the morning before other folks come in. So I think people are getting creative in making sure that you get the care you need.
And someone should, I was going to ask you too about mammograms. If a woman has one scheduled but doesn't consider it essential and then puts it off a couple months, that could, negatively impact her health, correct?
Yeah, I think so much of it is a risk benefit, right? So you've got people who are on, let's say, infusions, you have people who are on chemotherapy, and so much of this is trying to figure out what is the risk of pushing it off versus what is the risk of getting it done, or what is the benefit of getting it done on time. So I think a lot of it has to do with discussing with your doctor and having that risk benefit discussion. But the nice part is a lot of practices have gone into telemedicine now, so you can have those discussions virtually without having to expose yourself necessarily without acknowledging what that risk is.
Doctor, I want to ask you about this safe social distancing that we're talking about. And some people are like, well, what does that exactly mean? And how does it help the spread of the virus? Well, prevent the spread of the virus, rather.
Yeah, so the whole idea, right, behind droplets are, they go into the air. Let's say you cough, you sneeze. And they typically don't travel more than 6 feet. And so that's really where that 6 feet social distancing, or some people actually would prefer to call it physical distancing, right? Because on one hand, you want to be physically distant, but you want to still be socially engaged. So that's where that term, I think, is a little bit of a misnomer. But the question I get all the time is, can I go out for a walk? Can I go out, for a run? Those are all fine to do if you're maintaining your distance. And interestingly enough, on the CDC website, where they talk about, particularly for adolescents, right, where this time is pretty challenging, they actually are recommending, with adolescents, sometimes it's even safer to be outside than inside because it's easier to maintain a 6 foot distance outside rather than inside your home. So, I think that there's a lot of, safe distancing doesn't mean quarantining yourself at home. You can, go out with your children for a walk, go out, get some exercise, but don't get too close. Keep that 6 feet.
So I want to ask you about this transmission. So you said the droplets. So if somebody were to be close to you and they sneezed and they had the coronavirus, you could potentially get it?
You could, and that's where even sort of some of the, right, if you're going to cough into your elbow, sneeze into your arm. So, but they don't stay suspended in the air for a long period of time, right? So droplets, they're not there in that air for extended periods of time. So they go there. If you're in the vicinity, you can get exposed, but they're not there permanently. And so that's really the piece where people have to understand is if you keep that distance, those droplets, chances are, will not travel as far as where you are.
Is it possible for someone who has it to touch a product, perhaps at a grocery store, and then you come along and you pick up that product? Could you get it that way?
There are. And so, there's been a lot of data and scientists are studying based on different types of materials. So how long is it on plastic? How long is it on cardboard? But I don't think there's any conclusive evidence as to, what what actually can hold for how long. I mean, there's more and more. I think we're still trying to learn more about it. But you do see people wearing, gloves in the grocery store, masks. And one of the things that I always tell people, particularly when you're wearing masks, is we have a major shortage in the healthcare field right now with this personal protective equipment. And particularly with the masks, the N95 masks, you have to actually be fit tested to make sure that fits for you. And so when you're buying them, you're stocking them up, you're wearing them around, you're actually preventing healthcare workers who really need it to get it at the time of need. So I urge everyone to really think about what you're trying to do when you're wearing all those things in the grocery store.
Is there any value in wearing a mask at the grocery store?
Well, that's kind of where, like I said, I think it's, maybe a simple face mask. But to be honest, if you're keeping your distance, it doesn't really make that much of a difference at that point. And an N95 mask, like I said, we go through a whole process of getting fit tested to make sure that it actually works for us.
Any last minute advice for folks as they perhaps have to go to the grocery store or picking up takeout, things like that?
At the end of the day, I think just be smart, use common sense. I think there's a lot of hype. There's a lot of fears. Don't let the fears get over you. And at the end of the day, just wash your hands. I know we keep talking about that over and over again. I've taught my kids to sing happy birthday twice every time you wash your hands. It's a good, you get your 20 seconds in there. So just be smart and don't let the hype get to you is the piece of advice I've got.
We will certainly take that advice. Dr. Vsanth Kainkaryum of 4 Elements Direct Primary Care in South Windsor. We thank you so much for joining us, sir. Have a good weekend.
Thanks, Dennis.